Early versions of healthcare benefits became available. Pensions, the earliest pensions became available. Vacation benefits, the company towns, all the stuff you may remember for the history books. And then at that time, and then later, after World War II, the ability of business, because we were really unrivaled, didn't face anything like the global competition we have today, the ability of corporate America to pass on through slightly higher prices the cost of much of America's welfare state basically fueled a system that was able to put that burden on corporate payrolls. But all of that's changed. We know the world has changed. Even if it made sense 50 years ago, when healthcare cost 5% of GDP, say in 1960, not 17% of GDP, headed to 20% over the next decade, where it is today, where back then you had a single breadwinner working 35 years at a major firm that could provide those benefits, and the family unit got those benefits around it. Now we know young people today, by the time they're 35 or 40, are working 8 or 10 jobs. The inability to have health care that moves with you as you go, especially if you've got any kind of pre-existing condition, is a huge barrier to entrepreneurship and growth. Everybody knows folks who are stuck in jobs because they or their family needs the health care. And so, and the costs, of course, are sinking global competitiveness of American business, even while this bizarre, uniquely American structure of our system helps contribute to the fact that we've got 50 million Americans outside the system uncovered, and we've got 25 or 30 million more Americans underinsured who find out when they actually need care that what they've got doesn't fit the bill. So we're trapped in this old way of thinking that the corporation should be at the center of this system, when in fact its day has passed, and we need to think in fresh ways. Now, my big question when I come to this, and I spend part of my time as a management consultant, so I deal with senior executives across corporate America all the time, is to ask, why does business cling to this, even though it seems profoundly in business's self-interest, as well as in the country's national interest today, for the burden of health care costs and administration to be shifted from business to government? And I basically hear 3 major objections as I make the rounds among CEOs and business groups. The first, and this is someone like Tom Donahue, the head of the U.S. Chamber of Commerce in Washington, will say, if we've got a better health care plan than the company down the street, that's essential to the way we recruit and attract and retain the employees we want. And I understand the desire to recruit and retain and attract employees, of course, but that can't be a trumping argument, because if you look at the pension side, government provides through Social Security, established since the 1930s and built since then, a basic universal pension that's modest, and then business can add on top of that any additional pension things it wants to as a means of recruiting or attracting or retaining employees. The same thing could happen in healthcare. So I think the war for talent argument that says business needs to be at the center of the welfare state doesn't ultimately hold water. The second argument I hear, and this is from folks like John Castellani at the Business Roundtable, who empowered, had a group look at this of CEOs, and he said, our CEOs rolled up their sleeves and came out saying, no, we want to remain at the heart of this system. And I said, why? And he said, because we think that if it shifted to government, we'll end up paying more, but this time we won't control it. And I think to myself, but that argument can't be persuasive either, because right now, remember, we're spending 17% of GDP with the most involvement of the private sector in healthcare of any advanced country in the world. We spend 17%, everybody else spends 10 to 11. They cover everyone. We've got 50 million left out. And we have these huge regional variations in the intensity and utilization of procedures. If you're familiar with what the clearest proof is of the radical inefficiency of the U.S. healthcare system, we're like the poster boy today of an inefficient healthcare system. So, and by the way, if you're interested in that, Atul Gawande has a piece in the New Yorker, the June 1st issue, that's, I think, the most important piece written on healthcare costs probably in several years, and I urge you to look at it. But we're the poster boy for inefficiency in the U.S., and besides, I would say to John Castellani, if the powerful U.S. business lobby makes it its objective, which I think it should, to permanently lower the trajectory of its contribution to U.S. health costs while being a constituency for whatever else government may need to do to plug the revenue hole to make sure that everyone's got basic health coverage, that would be the outcome. But that's not the way most of the business community, not CED, which is unusually farsighted, but most of the business community today still thinks that they should be at the center. The third argument I hear And this is from people like Steve Bird, who's the CEO of Safeway, who has been a leader in benefit redesign. You know, what Safeway is doing is sort of showing the way for what government will probably end up doing and trying to adopt different wellness and prevention measures into benefit design in ways that boost healthcare outcomes and quality while also keeping a lid on costs. And Steve Bird will tell you that we need to have business at the heart of this. This needs to be on the employer because only employers can come up with the innovative things that will give their employees what the business thinks they need. And I think, but you know, even hailing what Safeway has done, that can't be persuasive either, because first of all, if any of the progress that people like Safeway and other innovators have made is going to have impact on a national scale, it'll only be when government, through things like what President Obama and those on the Hill and their Republican counterparts do to try to incorporate these innovations at scale to something that affects the nation. But then, even beyond that, on Steve Bird's logic, Safeway ought to be building its own schools and raising its own army to protect Safeway employees too. And I know he doesn't mean that, so because that's where the logic of his argument would push. So the question I ask myself is, what is really going on that's left business, which is ordinarily very pragmatic and very well reasoned, clinging to its traditional role at a time when I think virtually all the objective evidence suggests that it makes no sense. And I think that at the end of the day, it comes down to an almost unspoken, small-I ideological fear or objection of shifting the burden of this to government, that something bad will happen. And I want to challenge or urge fair-minded business folks in this room and people who are friendly with business leaders in this room to urge them to open their minds to the fact that the time has come to rethink that. You know, the business community, and I'm a business person. I spend a lot of my time helping businesses try and improve their performance. The business community has a kind of stunning record of opposing major measures that have become absolute fixtures of the American social contract. The small part of that list includes business-opposed child labor laws, the Federal Reserve's creation, the SEC, Social Security, national parks, federal aid to education, Medicare. The list is long, and I think for my fellow business people, embarrassing. There's a lag time, I think, where the sort of consensus climate of opinion among business leaders lags behind where the society needs business to be willing to go. And I think that's especially tragic at a moment, at a rare window of reform that we're moving at right now, when the chance to move beyond today's archaic system doesn't mean moving down some slippery slope to socialism. I think that fear is unfounded. There are ways we can do it that are market-friendly. CED has been a pioneer in designing market-friendly forms of universal health coverage, and you're going to hear more about that plan from Alan Enthoven in a moment. So what I'd urge you to take away from this is that there is still time this summer for business to change its mind and not just push and back the health care reform that Washington is going to try and do. Which is on, I think, a pretty important and ambitious track. But right now, business is slated to remain at the heart of this, basically, when the dust clears, unless business mobilizes in a way and says, you know what, it's time to rethink. My own view is it's time to declare victory and move on. America vanquished communism and socialism after an epic struggle, and the employer-based healthcare system deserves its share of credit for the triumph. But that century-old strategic choice set in motion political patterns and habits of mind that have calcified to the point where we can't now do what global competitiveness and social justice now require. The only force that can break this logjam is business, and business can only do it by looking at the facts and changing its mind. We won't become socialist. We're still going to need to address costs. Firms that want to can still serve as facilitators, if not primary funders of coverage for their employees. And none of this means that business is going to be walking away from the problem. Indeed, business is going to need more than ever to be a constituency for the changes that are necessary. All this is doable, but one tumbler first has to click into place. Sooner or later, business has to realize, and the rest of us have to help business realize, that when it comes to its pervasive role in America's welfare state, it's okay and sensible to let go. Thank you.